I'm 41 and overweight, just got a checkup, but my doctor says a plant-based diet is better than going on testosterone replacement. What's your thoughts? I don't want to be going in circles. This is G Smooth. Okay, so I think one thing we got to be clear of is my hardest patient population to treat are vegans and vegetarians. You know, just being all plant and no meat is really, really a difficult situation for me to treat. I'm just going to be honest with you. But I'll also say this, there's so many nutrients in our plants. But just focusing on a plant-based diet and your testosterone is low, I'm not sure that's going to give you the boost that we may need. Now, losing weight, getting better sleep, getting more nutrients in the body, getting on a resistance training type of exercise program or a high intensity interval training program, switching your diet to a more of a Mediterranean based diet has been shown to boost testosterone production, but just giving you the advice to go eat more plants and switch to a plant-based diet, I think is giving you a disservice. For instance, these plant-based meats, that's not going to be better than a good old-fashioned grass-fed, organic, hormone-free, antibiotic-free cut of beef. It just isn't. So sometimes, and I used to be guilty of this as a physician, sometimes we will buy ourselves some time or send you off a little bit and be like, yeah, go do a diet, come back, lose some weight, and you're going to feel so much better. But did the doctor give you a plan to help you lose the weight, to facilitate that weight loss process? You know, instead of just telling you to go eat a plant-based diet. So my advice is always, what type of diet should it be? Study after study shows that the Mediterranean diet is a great way to go because you get a chance to have some great healthy seafood. You get a chance to have some meat periodically, but you're introducing really great veggies and grains. And the data is very clear that with the Mediterranean diet, what we find is that guys who adhere to it just have way less ED than guys that don't. And I think that speaks volumes for it because, too, they focus on really healthy fats. And in our country, I remember sitting through a seminar where this was about 6 years ago. This is when I decided I could no longer be a traditional Western medicine doctor, that I needed more and that my patients deserved more. Is I was sitting through a seminar and the doctor that they had hired to give the workshop, now there was a sea of doctors. I mean, it was just at the McCormick Place in Chicago, a sea of physicians all sitting around. And, you know, they're sponsored by drug companies. And the drug companies hire these doctors to come through and give us these great lectures. Well, this whole lecture, the whole day was based around the concept that most of our patients needed to be on cholesterol-lowering drugs. They needed to be on statins. And I remember going at lunch and asking some of the other doctors, I said, well, doc, what do you think of the presentation? Well, it's good. As we're eating our free meal, you know. And I said, you don't think it's weird that he's saying that all of our patients, even the ones in their 30s, we should be putting them on cholesterol lowering medication? They're like, well, no, I mean, the data shows. Well, here's the thing. When we lower your cholesterol, what we're doing is we are removing the building block, the foundations that you need to make hormones. You need cholesterol to make testosterone. You need cholesterol to make thyroid hormone. So when the thing about the Mediterranean diet is that you are eating a bunch of healthy fats so that fat, which is cholesterol, can help your body better make the testosterone that it needs. So that's one thing. The other piece is, if you are borderline low on testosterone and you do all the lifestyle changes that you could possibly do, you listen to the lifestyle changes that we talk about, you've gotten my ultimate stiffness bundle, you're doing that, you know, you're consuming this information that we put here, and you still can't get your testosterone up, you've lost the weight and all of that. Listen, it is time to stop dancing around and figure out how to find a doctor who knows how to treat your testosterone deficiency and will give you some testosterone hormone replacement. We know that guys who have low testosterone are more likely to be diabetic, and they're more likely for their diabetes to be out of control. We know that if you're low on testosterone, you are more likely to have heart disease. If you're low on testosterone, you're more likely to have erectile dysfunction. If you are low on testosterone, you are more likely to have a poor quality of life. If you're low on testosterone, you're more likely to have depression. So when you look at it like that and you see all of the things that low testosterone is associated with, now you've got a better talking point with your physician to really just say, look, doc, do you know a doctor who really does hormone replacement therapy? I recognize that you don't want to put me on it, and it's likely because you don't put very many patients on it, but maybe I want to hear from the experts, the ones who do this all the time, how this could benefit me. No disrespect, doc. I just not feeling good and I want to feel better. You got to have those conversations with your doctor. Otherwise, they will put you off and they will keep talking about it till the next visit, which is 6 months from now, right? And then the next visit, which may be a year from now. So, you know, time is precious. Time is money. You have friends that have passed away. I have friends that have passed away. And one thing that we know is that each day is not promised, and we've got to live life to the fullest. If your testosterone is low and you're not feeling good, your doctor needs to work with you to get you on some, to be honest. Boost it up as naturally as possible, and then we've got to go the next step, okay? I can't say that enough.